Hi everyone, happy Thursday. Welcome to today's webinar, Increasing Mental Health Awareness Through Community Outreach, Mental Health Month 2021. My name is Emily Scahill. I'm the Manager of Public Education at Mental Health America's National Office, and I'll be moderating today's webinar. A few notes before I introduce our presenters for today. We are recording this webinar, and the recording and slides will be sent out to all registrants within the next week. You'll also be able to find them archived on MHA's website, along with all of our other webinars at mhanational.org/webinars. We don't offer CEUs, but if you would like a certificate of attendance, we do have a form for you to request one. I'll post the link to that form in the chat throughout the webinar, and it will be included in the follow-up email as well. And last but not least, we've built in some time for a Q&A today. So please post your questions in the chat box throughout the presentation, and we'll go through some at the end. And feel free to make comments or share some of your knowledge in there as well. And I'm so excited to introduce our presenters today. We have some of the MHA national team with us, as well as our Kentucky affiliate, to share ways that you can use the Mental Health Month Toolkit and spread mental health awareness in your communities. So we'll start with America Paredes, MHA's Vice President of Partnerships and Community Outreach. She works to educate the community about MHA and its programs, as well as researching, engaging, and developing strategic partnerships that further MHA's mission and vision. We also have Whitney Ball, Associate Director of Marketing and Outreach at MHA. She helps manage MHA's Associate Membership Program, as well as other outreach and advocacy efforts. And last but certainly not least, we have Marcy Timmerman. She serves as Executive Director for Mental Health America of Kentucky. She's been a mental health advocate in Kentucky for 15 years and has worked in social media messaging and grassroots connecting for several organizations over that time. So happy to have all of them with us today, and now I'll turn it over to America to get us started.
Thank you, Emily. I appreciate that introduction, and I am so happy to be here with you all. As Emily said, I am America Paredes. My pronouns are she and her. As the Vice President of Partnerships, I am really excited about being here and sharing some content with you. I hope that you make the most out of all the materials that we create for Mental Health Month. And if you do have questions, please ask them all along the time we are presenting. We really want this to be a conversation where you engage with us as well as we engage with you. So I'm going to go ahead and get started. So this is a little bit about who we are, and right in the center of this picture is Emily. This is a picture, really I think the last time we were all together before the pandemic. And it really is an opportunity to really see who we are as people. There are actual people behind the materials that are out there in the world. And to give you some context about who MHA is, if you are not familiar with us, we work to change the laws that help people get mental health help when they need it. We also teach people about mental health to help them understand that what they are experiencing is normal. And then we go out into the community to talk about mental health so that the problem of mental illness is not ignored. Now, a little bit about May is Mental Health Month. We actually started this observance in 1949, which is an amazing thing to think about now that we are in 2021. So we have been doing this work for several years. Of course, each year we strive to do even better, which is a lot to do every year, really thinking about new themes and really listening to what's happening out into the community so that we can create materials that resonate with the needs of people throughout the US and beyond. Generally, we create these toolkits throughout the year, not only for Mental Health Month, but in other national observances, but our materials are also available in Spanish, and we reach over 85 million people a year, hopefully even more this year. A little bit about the Mental Health Month goals and purpose. So in general, what we are attempting to do is really address mental health conditions before stage 4, or what we call our before stage 4 philosophy, that helps really envision the idea that we want to prevent mental health conditions before they reach a point of crisis. When most often people actually start talking about these issues is that crisis point. So we want to think about early intervention and early identification and prevention as a key to helping individuals address their mental health concerns early on in the process. Now, the purpose of Mental Health Month is really to make mental health awareness easy to explore and easy to understand, and fundamentally make it very easy for organizations and individuals to utilize our materials so that they do not have to expend resources to create graphics, to think about messaging. We do it all so that it is really a plug and play kind of concept where you utilize materials and send them out into your community. Now, when you think about the audience that this content is created for, it really is intended for everyone. The idea is that we all face challenges along our lifetime, and we have to not only be prepared to address them on our own, but we also want to be able to support other individuals who may need guidance and assistance through their mental health journey. So the content is intended for a wide audience. There are other materials created throughout the year that are more focused on different populations, including individuals who may identify as part of the BIPOC communities, LGBTQ+ communities, youth and parents, and more. So those other kind of pieces of content are also available on our website. Now, when you think about who actually uses our mental health materials, here's a list on the slide of a range of folks that actually go out, download the toolkit, and then go and use it. At the beginning is really community advocates. I would imagine many of you on the presentation today are community advocates, are doing the work in the communities, understand what your communities need, and are really dedicated and passionate about getting mental health awareness tools into the hands of people who need it. Now, when you expand that a little bit further, we have community-based organizations. Similar to the work that Marcy is doing in Kentucky, we have MHA affiliates across the US, other organizations that may work with us, like faith-based entities, peer-led organizations, small private practices, you know, and the idea is that this material is really created for everybody to be able to utilize and then supplement with local resources that you may have available and or are aware of. So not only is it useful for folks that may be parents or teachers, it could be used for college students. Ideally, it really is intended for you to take what you need from the toolkit, and we're going to talk about the different components, and think about what's happening in your community and where can this material fit. So alongside here, you'll see this image that was created by one of our very strategic partners. Her name is Gemma Correll, and she creates these images that align with our Mental Health Month messaging every year. And this one, she is depicting, you know, the idea of embracing your feelings and everything that comes with that. So we really value her work and want to also make these types of content available for folks. And we do that through our social media, and then again, something that you can repost. Now, when you think about the theme for this year, it is Tools to Thrive. The idea behind the Tools to Thrive content really is to provide individuals with information and coping strategies around common struggles that affect mental health. So the Tools to Thrive theme was also used last year, but what we did this year is expand on that. So some of the topics that we are exploring include adapting after trauma and stress, which I think everybody can resonate with within the last year, processing big changes, getting out of thinking traps, radical acceptance, taking time for yourself, and dealing with anger and frustration. All of these things outlined here, in many ways, every one of us have dealt with in different scenarios. But when we think about that a little bit broader, all of these issues are bubbling up in our communities, and oftentimes people don't know how to process everything that's happening. So the tools that we create are intended to then help guide that conversation, help you as the provider of this content to know what to say, to kind of guide individuals down a path of finding additional resources and really finding support. So if you have not yet downloaded the toolkit, please do so. It is free. It's accessible at mhanational.org/May. On that page, you'll be able to actually click on a link to download the toolkit. There are also links to the Spanish language materials as well. And then in addition to that, on the left-hand bar of that web page, you could access previous year's content. So some components of the toolkit include media materials. So those things are key messages, drop-in articles, proclamations that can be used in your local city government and other kind of entities. There are social media and web components, including graphics. So one of the things that a lot of people struggle with is thinking about how do I write something that is useful on social media? We've done all the work for you. You don't have to rethink how to create anything. You just copy and paste and add a graphic to it. Then we have fact sheets and worksheets, posters that can be printed out, and then we have outreach ideas, which Whitney will share a little bit more about later, and then additional resources that can be utilized in your local community, as well as supplemental information that may be useful to you as you continue to do your work. Now, I'm going to specifically focus on a couple of the toolkit components. One is the key messages. When we develop the content, one of the key things that we want to do is really help you frame the conversation in your community. Whether you're helping one person sharing this content in a newsletter, going out and having different types of outreach events, we want to make sure that you're talking about these issues in a way that resonates and not only is able to capture what is happening, but helps you frame how all of these materials come together. So the key messages are included there for that purpose. Then the social media content. What you have in the toolkit actually includes content that not only focuses on about guiding people to download the toolkit, you may also have general kind of language on how to talk about the Tools to Thrive theme. And then in addition to that, we have very specific content around different facts that are available that people can utilize, including graphics that are supplemented from the content in the different fact sheets and worksheets. So here you'll be able to see a link that just says images. And in that image file, there's a link that you go to and you can actually download all of these images. This is just a sampling of what's on there. There are over 30 images on there. All you have to do is download the images, save them onto a folder, and then make them usable for yourself. Now, on the right side of the screen, what you'll see are two samples of products that are included in the toolkit. One is getting out of thinking traps. So this is the English language fact sheet, and with that comes a complementary worksheet. The idea between the fact sheet and the worksheet is that the fact sheet is going to give you all the facts, all the information you need around this particular topic. And then the worksheet is going to help you really work through all of the things that are needed to get you to grasp this concept that we're trying to get you to understand. And in addition to that, the purple content here, which is Cómo procesar los grandes cambios, is a direct translation and adaptation of our English language materials into Spanish. So the entirety of the toolkit is not translated in Spanish. All the major components are, including the social posts, the key messages, the images, the fact sheets, and the worksheets. So all of that is there for you to use, especially if you have folks in your community who are Spanish language speaking. They're easy and there for you to use at all times. Again, what I think is most useful is all of this is available as one downloadable toolkit. So you don't have to go out and figure out where can I find these other pieces. They're all there in one place. Now, I'm going to pass this on to Whitney, who's going to share information about our outreach efforts and how we have implemented different activities throughout our time so that you can do similar things and go from there.
Thank you, America. Great information just going over our toolkit. I always get so excited when we flip through everything that our toolkit offers. The whole idea behind the Mental Health Month Toolkit is to give you all the tools you need to start conversations in your community around mental health, to raise awareness, and we want to make it as easy as possible. We know that so many of you are already taking on so much on your plates, both as an individual and an organization, and really turning your focus during May to mental health might feel like a challenge. So the toolkit is something that you can download and then use within your community to help spread the message. And community for everyone is different. So I'm going to talk about some ways that you can take this content and bring it into your community, however that looks to you. There's some pictures up here on the screen of us actually going out into the community and exhibiting and talking about mental health, obviously pre-COVID. But if your city or your town or your community is kind of opening back up and, you know, vaccine rates are high and you're feeling like it's a safe time to start spreading the word in person, there might be an opportunity to do that. I want to highlight, you know, you don't have to create a whole event from scratch to spread awareness during Mental Health Month. You can think about some events that might already be existing in your community and then plug yourself into those events, get in contact with the person that's leading those events, and see if you can raise awareness for mental health at the event. When we were talking initially before, you know, presenting to you all today, the first thing that came to mind is, you know, maybe you talk to your local government who's managing the distribution of COVID-19 vaccines, and you see if you can set up a table to just pass out information. You know, you don't have to stop and talk, or maybe you can, you know, stand in the car line and walk down and pass out those fact sheets, or hand out the different worksheets just so people are getting that information. One thing we always say when you are going out in the community, if you are doing an event, is that unfortunately we know that the stigma around mental health is still prevalent. So if you can add an interactive component to whatever outreach you're doing in the community, it really can kind of break down some of those barriers, get people to shake off those nerves a little bit so that it feels more approachable. So they're not just walking up to a booth that says mental health, you know, because that might not be something they want to do. So you'll see down here we had, this again was pre-COVID, we were exhibiting at a health fair to talk about mental health, and we did a little prize wheel with facts about mental health on it. You also see that we did something with note cards where people could write messages of hope to someone dealing with a mental health struggle. So people would walk up just wanting to see what that was about, and then we could then engage them in a conversation around their own mental well-being. So making it a more approachable piece. And then the last thing I want to highlight when thinking about outreach broadly is meet your target population where they are. So if you're thinking about implementing a mental health month campaign, using some of the, you know, downloading the toolkit and wanting to get involved, think about who you want to reach. And this doesn't necessarily need to be the people that you always reach. You know, if you are a community mental health clinic and, you know, you're always reaching people who have a severe mental illness and need support right away, you might want to think of focusing your mental health month campaign on the general population. So meet them where they are. Hang a poster up from our toolkit in Starbucks. Go to your local school and do a presentation on mental health to the staff. You know, there's different ways to kind of think, where is your population? Where are they always going to be? And where can you plug in mental health resources to that? America, you can go ahead and go to the next slide. All right, so now let's talk about COVID, because for many of us, in-person outreach events are not possible right now, and we are still trying to think of ways to raise awareness. And the good thing is, in my personal opinion, it gets even easier, because America and I, when talking about this presentation, were laughing about pre-COVID when we would be pulling our wagon of like all of our supplies for outreach events, and having to set up our tables with our fact sheets printed out, and having to sit there for, you know, 8 hours. With digital spaces, it's become even easier to reach audiences and share this mental health month materials. So in that toolkit that I hope you all have already downloaded, and I know we dropped the link in the chat, but again, it's MHA National/May, or MHAnational.org/May. But in that toolkit, you will find pre-written content that you can just plug into your different communication channels. So I'm not asking you to, you know, get someone to write a whole bunch of social media content. You know, you don't even have to write a whole blog. We've done done that for you. You just need to get it posted on your site. But if you are wanting to get creative, I put a few examples of what we've done at MHA around social media. You know, you have the option of going live on Facebook or on Instagram, of hosting a Twitter chat, of bringing in outside audiences, of doing a webinar. You know, these are things that you can use that pre-written content and implement it and kind of get creative with reaching people. We even did, I loved the one we did with Tati Gabriella. We did an art party, you know, because you don't just have to sit there and talk. You can do an activity. Maybe you want to take one of the themes from the month and you want to focus an Instagram live on processing big change. And you could have somebody from your organization really talk about what that has looked like in their lives, sharing their personal challenges with it. These are very, you know, I haven't flushed out all these ideas, but this is the kind of things I'm asking you to think about when you're wanting to do outreach digitally. And the best part about the toolkit is that we also have a whole section on outreach ideas. So that also might help you get your wheels turning. But the whole idea is that this shouldn't be a huge lift for you and your community to spread awareness during Mental Health Month. And you can always use your channels that already exist. Maybe you're a company and you're in the HR department and you want to raise awareness during Mental Health Month to your employees. Grab one of those key messages and pop it in an email that goes out bi-weekly, or pop it in your newsletter that goes out to supporters, just so that you're helping with this increased need for mental health content during the COVID era. We know, we've seen through our screening data that people are looking for resources, so you can help be that resource and direct them to mental health education and kind of break down that stigma. And with the toolkit, that's what makes it so easy, is you can kind of just build on that. So there definitely can still be outreach done during the pandemic, despite, you know, less and less of health fairs happening and, you know, tabling in the traditional outreach we kind of think of in our heads. There's still ways to share this information with your community, get interactive with them, get them involved, so it just doesn't feel like you're missing out on a whole mental health month because of COVID-19. America, you can head to the next slide. All right, and I want to touch a little bit on the MHA Screening Program and a way you can also use this in conjunction with the Mental Health Month Toolkit. So I know that there are a lot of people, I'm looking at the chat, there's a lot of participants on here from our affiliates, so this is going to be, you know, old news for them. But if you are new to the MHA community, or you haven't, you know, explored some of our resources and want to touch on our screening program, we offer 10 online, confidential and free mental health screenings that people can take at their fingertips, you know, computer, iPad, phone, and get information about their mental health right there in less than 5 minutes. So this is a great tool to push out to people during Mental Health Month in conjunction with the Mental Health Month Toolkit content. So a lot of times people are hesitant to spread awareness for mental health during May because they can't offer services, or they don't know where to direct people. So this kind of helps you fill that gap and give you that solution. So when we are in person, we often have iPads or computers so people can take a screening at the event. You'll see right here, this picture, they're holding up an iPad of the screening so that people could come up, we could start talking to them about their mental health, and then we would be like, oh, do you want to step aside and take a free confidential screening? And more times than not, people were really eager to kind of get that information about their mental health. The URL for the screening program is at the top of the screen, mhascreening.org. And some of the language in the toolkit already includes stuff around screening, and some of the graphics you can download are also about screening. So I just really wanted to highlight this for all of you as an additional resource to share during this month. I know before working at MHA, I was always hesitant to talk about this if I couldn't give people an actionable thing that they could do to really support their mental health in the moment. So I'm always happy to share this resource with you all. It's free to use. You're welcome to promote it, and we've included language on how to do that in the toolkit. I will plug just at the bottom, if you are an organization that is not already connected to MHA National in some way, like through our affiliation or through our associate membership program, you can look at joining our associate membership program, and I'll drop the link in the chat in a little bit, to get a unique URL to the screening program that you can promote in your community, and then we can give you data about that. So I'll drop a link if that's something you're interested in joining as an organization, to kind of continue advocating and getting the resources your community needs. But the screening tool is just a really great way to give more resources to people while you're promoting during Mental Health Month. I think you can head to the next slide. All right, awesome. And with that, I am so excited to introduce Marcy Timmerman. She is Executive Director of MHA Kentucky, one of Mental Health America's affiliates. And we asked Marcy to come on and talk a little bit about how she utilizes the Mental Health Month Toolkit during the month of May. I told her before you all hopped on, like, she's a superstar in implementing this within her own community, and she like does it all by herself. So I think she's a perfect example of how you can easily utilize these resources. So with that, I'm going to turn it over to you, Marcy, to share your experiences with the toolkit.
Well, thanks for your kind words. Yes, we are a statewide affiliate with just one solid employee. That is me. So we do try to maximize our reach and our outreach, especially in COVID, utilizing every digital tool possible. You can go ahead and switch the slide. So, sorry. Thanks, Emily. So one of the things we did, we actually took the sample proclamation. I pretty much just dumped it right directly into the proclamation request in Kentucky. And fortunately, our governor actually got 3 of them. So it wasn't just us that asked for it. Our Department of Behavioral Health and Developmental and Intellectual Disabilities asked for it, and so did Mental Health Louisville, a new group of activists. So we're actually sharing the proclamation along us, but we all dropped the same information in because of the toolkit. I thought that was really amazing. So we get to have an event with our governor, right? And what better press? And our governor's actually been really pro mental health the entire bit of COVID. He actually came into office just a few months ahead of COVID. So it's really been a theme in his tenure. So I think it'll be awesome to see, and just shows you, all you can do is ask, right? And having 3 asks meant he made it a priority. So go ahead, next slide, please. Some of the other things we've done with the toolkit this year that I think is really important, and I've kind of used it in past years as well, but I love making the webinars with each live question and answer, and then sharing those on Facebook Live, Instagram TV. We throw them onto YouTube. So one webinar. So we actually already did the processing big changes one, because I moved it a little bit up because I wanted our practicum student to be able to do it. She's a graduating senior. She was a bachelor in social work student. So she was able to talk about big changes, like having lived through some COVID, having gone through college. She personalized that material for us. I thought that was an amazing webinar. And what we did is we put it up on YouTube. We're going to have little video clips of each talking point that she brought up that we can share later throughout the year, actually. We turned the audio into a podcast that'll be available soon. And then sometimes I'll even break out an image with quote of a good line from the conversation. So that one hour live thing on my Zoom, right? It's just my Zoom account that we pay for already. So it's almost $0 for us to do these things. We make the best out of them. So yeah, we've got dealing with anger and frustration coming up next week, and accepting reality at the end of the month. I've got one for each of the toolkit pieces. So I love the toolkits. I've loved this. And seems to be a really popular way to get that information out to people. We're doing them at noon most of the time, and early morning, depending. I'm trying to kind of find our audience's sweet spot. So I moved a few of them. But just so you know, you can do that, right? Like, it doesn't take a whole lot of time. I'm going to be presenting on most of them, but I'm going to be using the material from the toolkit itself. And that's what I'm going to do, is make people actually pay attention to it. So rather than just hand out a flyer, right, they're actually going to have to pay attention if they come on board. And I think that's awesome. Next slide, please. So we use the buzz from the toolkit. We have been promoting the toolkit pretty heavily. I've been here 4 years now. So the past 3 years we promoted, and I know we did before as well. It really started making community conversations. So those same webinar ideas, we went ahead and made some partnership conversations. So we talked with Life Adventure Center today about adventure therapy. It's kind of a new emerging technology and piece of therapy. And so we asked questions, and that'll be up soon on our website. It's on our Facebook if anyone wants to see that live. Horses are huge in Kentucky, right? We're known for the Kentucky Derby. It just finished. So we decided it's time to talk about equine therapy. We haven't done anything on that for a while. So we're going to talk with Central Kentucky Riding for Hope, which does some equine therapy work, about horses and hope and kind of cover horses together. And then the Kentucky Psychological Association actually did several partnerships with us. We have several Ask a Therapist moments, and then we're going to talk about trauma-informed psychotherapy. So talking about all the different types of trauma treatment kind of in short term and seeing which ones folks want to learn more about. So we're doing these same things. We're putting these on the web. We're going to put them on Facebook. There's going to be live Q&A. You know, we're going to make little clips as that comes up. You know, what is adventure therapy will be a clip, I'm sure. Things like that we can use moving forward. Go ahead and skip ahead here. So we also worked on our relationship with the press with the years that I've been here. One of the first things that I was impressed with was I got invited to our local PBS station, which is actually a statewide station. I know that's a little weird for PBS. We actually have one statewide station. Renee Shaw, who's the host of this Connections, is a very well-known personality in our media across, and she's very, very well respected across all the political groups and everything. She reached out to me because of the toolkit, and we sat down and had a whole conversation about it just a couple of years ago, and we've really made that a very strong partnership moving forward. I'm one of her go-tos for mental health information now. That all started because I shared the toolkit with KET and said, can you use any of this? So reach out to those places. Another thing about the toolkit is our local unions in Louisville, Kentucky, all of them really decided to promote mental health this year. They've had some suicides amongst the trades folks, and they wanted to make sure that they're doing that prevention and early treatment information that we offer, and that differentiates us from some other charities. So they decided to pay for advertising for us and promote the toolkit, but also promote giving to us. So we made that partnership clearly because of the toolkit, because it's accessible, it's understandable, it's relatable. Go ahead, next slide, please. So, and that is what we've done. Feel free to ask me more questions, but I'm going to give it to Whitney for the resources.
Oh my gosh, I just am so impressed every time you talk about everything you've done, Marcy. It's so awesome. So definitely, we will have time for Q&A in like a minute. So definitely pop any questions that you all have in the chat for Marcy specifically, or for America and I regarding Mental Health Month, getting involved, all that good stuff. We wanted to highlight a few resources from MHA National, just so you all know. The recording will be sent out, so you don't have to try to write down all these URLs. But we have our Mental Health Month toolkit. We have our support tools on our screening site. We have resources specifically for BIPOC communities, LGBTQ+ communities. We do a toolkit for back to school, and so we have all of the past toolkits on our website, and then we also have resources for college students. You can head to the next slide. Awesome. So if we wanted to just highlight crisis support resources, if you or someone you know is in a mental health crisis, there are supports available through both warm lines and call and text crisis lines. So just wanted to note these as well. And I think that wraps up everything for our planned presentation. So we are going to stop sharing and open it up for Q&A.
Great. Thank you all so much for sharing such great information. So yes, like I mentioned, we have plenty of time for Q&A. So if you have questions, go ahead and send them through the chat box. We do have a few to get started with. So someone mentioned struggling having public events, how to best advertise those and get the word out. They've been using social media and local media services, but still struggling with getting people to actually show up. Any advice on that?
I think I hear your complaint. As someone who has planned in-person events for so long, it can be really a struggle to get people to show up to the events. I think one thing you might want to do, and then I'll definitely let America and Marcy jump in as well, is think about the barriers to accessing your event. So what time are you having your event? Is childcare an issue? Is food, is your event at 5 p.m. and kids have to get home from soccer practice and dinner has to be made, or college students aren't out from class yet, if that's your population. So thinking about the barriers to your population attending. And if you continue to, put a lot of resource and efforts into an in-person event and you're not getting the results you want, that's where you can utilize some of those virtual aspects. I think more and more people are now expecting that in the time of COVID. I think we've talked about, that's going to be the new norm. So it takes a little less cost and effort on your team. So it might be time to try virtual and see if you can get more people that way. And with that, I'll let Marcy and America jump in as well.
Well, I was going to say that's a very important point of discussion, because some of the things I think oftentimes is even the language that we use in trying to create an outreach event and how we talk about the event on flyers and things like that can be a little off-putting, because if we put something like, come and learn about your mental health, it's like, I'm not going to go and talk to people about my mental health in a public space. That's not what I want to do. But if you call it something like a health fair, a health gathering of some kind, it implies that this is just a broad conversation. So sometimes that is something that we have talked about specifically and needing to change that. It's also really important, like as Whitney had said, around the audience that you want. I know with some of our affiliates that have other programming that's available in different languages, for example, they were sending out flyers trying to get people to participate in these events, and then it was at 12 noon, and I said, well, in my community, folks that are working are not available at noon unless they're in a professional type of setting in an office where you may have an opportunity to do that, and even then you may have to use your lunch break for that. So if you're at capacity in terms of your kind of day-to-day, and then you're asked to do one more thing, it may not be the most feasible thing. So sometimes it may be necessary to think about doing things later in the evening if that's something that would be useful. And then really, I like this idea where Whitney was talking about, like, thinking beyond your normal spaces where you are sharing this content. So if you are in a community that you're consistently going out and, let's say, putting flyers up in grocery stores, well, when do you actually stop in a grocery store to look at some sort of, wall of information? Very rarely. I can tell you, I never do. The only thing I look at is my receipt and I walk out, right? But when I'm standing in the line at Starbucks or in the drive-through of McDonald's, Burger King, or these things, if there's something there, your eye might, more likely linger in those spaces. So I think all those things are very important as well.
Yeah, and to America's point about the evening events, that's part of what I love about our webinars that we're doing right now. They're virtual, but they're accessible to anyone whenever. We have quite a contingent of folks who access us between midnight and 4 a.m. on social media on a regular basis. If I can help you with your insomnia by talking about sleep hygiene, well, then why wouldn't I, right? But I'm not going to be awake between midnight and 4 a.m. I have a first grader, I have to be up at 6. So it just doesn't work, right? So making that content as evergreen and available as possible, I think helps as well. And knowing your social media audience is really important, especially now I find my audience is shifting again, right? Like it shifted at COVID and now it's shifting again. So recheck that information too, especially when you're posting those events and things. Are you posting when your audience is online? That's a big question that you should probably be answering. Also, in-person events are not popular with our crowd, so I'm not going to be doing that for a long time. And I honestly have been able able to get our word out by going to big events that are already established. So those big established health fairs, we used to sit at our state fair. I'm not sure that the return on investment for 4 weeks of sitting there was good, but maybe on a couple of days, that would be a great idea of just being, you know, reaching a new audience there was really good. But I don't know that we have that capacity in the future, you know. 4 weeks is a long time to man a table. But, you know, strategically deciding, is it worth it? Has been a lot of my job. You know, is it worth finding the volunteers? Is it worth the effort? And yeah, I definitely agree with language being a huge thing. When we do things in other languages, I partner with groups that are already trusted in that community because I'm not bilingual, I'm not multilingual to any efficacy. So, you know, working with those community agencies and making it their event, not necessarily our event, we're just a guest, helping provide that has really helped as well.
Great advice.
I wanted to add one more thing, Emily, if I could. One of the things that we have done is also taken opportunities to pop ourselves into spaces that are outside of the frame of mental health or anything health related. So if there's a booth like at a farmer's market, because I know in our local community there's farmer's markets, go and try to get a booth there, right? People will come, they'll be there. And those are the spaces where it's unexpected that you will have a presence, but that's where you can engage in real conversations with folks. So think about that as well.
Yeah, our food giveaway site actually let us give out our screenings data prior to COVID. So I'm sure we'll be doing that again next year.
Yep.
Great, and perfect segue into the next question. How can organizations collaborate with other organizations or community groups or things already happening in their community? Who should they reach out to? Where should they be looking? How do they get started doing that?
Marcy, do you want to take a stab at that? Then I'll add, because I know you do a lot.
Yeah, I think reaching out, making a phone call, making an email, right? That's the best way, especially to an MHA affiliate or somebody else who's sharing the toolkit already. If you want to just kind of hop on, most of us are really open to that. I think that there's this myth that nonprofits should be against each other or some kind of competition is in vain, and we don't do that. Like, I definitely don't do that. And I know that no one in our mental health space is doing that intentionally. So, you know, joining us, co-brand a webinar with us. Some of the toolkit opportunities I forgot to include are, I've gotten several calls, you know, I'm doing some executive speeches based on the toolkit because people were like, I want to share it, but nobody will come unless I do a lunch thing and I buy lunch. And I'm like, I will do that for you. And, you know, we can do it by video or I can come in person because I'm vaccinated, right? And it's just me. So I'm like, those kinds of things are wonderful ways to do it. It's really just getting over that hurdle, finding the right person to talk to. You know, go to the top if you have to. Go to the executive director and go down. You know, none of these places are so big that you can't reach someone.
I would say too that sometimes there is a lot of competition, right, between people and between organizations. But I think at the end of the day, we all have a very shared mission, right, that we want to help the community where we are located. And with that mindset, oftentimes we don't know what we don't know. So I know it can be difficult to send, you know, 75 emails to everybody in your community and say, we have this available, but that's a start. And say, if you're looking for mental health content, I'm your person, right? Reach out to me. And that little introduction can help really then create an opportunity for further conversation. You know, and the work that I do, it is about relationship building and really creating trust with other communities. So like Marcy was saying, you really, if you're not in a community that you really want to reach, do not go in and say you are there to save the day. You don't know anything. That's how you have to come in, completely humble and saying, we want to help you, but you have to tell us what you need. We have the resources, we have all this information and all that. So partly it's emailing, doing some cold calling, but also if you're not part of your local like nonprofit kind of association or the parent teacher association, even your local like building association, if you have one, try to get involved in those spaces because that's where conversations can really begin and then people can latch on to what you're doing.
I was going to add as well, you know, when you're thinking about partnering, if you want to partner with organizations to really get the word out, I love it. I think that's a great way. And I think all three of us and for Emily would agree as well. That think about too, like, what are the populations that you feel like drawn to and that you think really need this content? So maybe, you know, I've seen people put in things about students and about college students and K through 12 students, you know, see if you can partner with your local school or with the PTA or with the school board. And the key I would give you whenever you're approaching partnering with someone is make it seem like it's not going to be a huge lift on them. When someone approaches us, and I'm sure Marcy would agree, like it's easier for us to say no and be like, that sounds scary if it feels like it's going to be a massive lift on us. But if you're approaching someone and you want to partner on a mental health month effort or just in the future, and you say, you know, we really want to be able to tap into your audience. You have the access to that audience. We will bring the content and the expertise and we'll organize, you know, they're going to be much more likely to say yes. If you kind of like, here's this package that we want to give you. I know when I was working at the community level in Texas, that's what we would do with local school districts. And we would just reach out to someone at the district office and say, you know, we want to host this event. We want to bring this material to you. All you have to do is send it out to your email list or shoot it out on social media. And they were like, wait, and you'll plan the whole thing and like bring all the content. And so that's where people on here, if you're really passionate about a certain topic or about a certain population, that's how you can approach that so that it's a much more, you can have that conversation rather than getting shut down at the door because they think, more work. You can kind of start building those connections. I think that's kind of a way to approach it as well. And Marcy, were you going to jump? I like cut you off right when you were going in. She might have. Oh, Marcy, are you back? I think you.
I winked out at some point. Sorry about that. The internet is a fickle thing some days.
All good. I think that's some great advice on from both of you on how to approach partners. America is our partner guru at MHA. So anything she says, I think is a great piece of advice to take in.
Yeah, and if you're taking the toolkit out, which I think I misunderstood the question, so thank you both for saving that answer. Yeah, definitely make sure that you're doing that with the expertise. I think that was a good point, Whitney. That's when I get contacted by other people, it's because I've put it out there already. But yeah, I definitely have hounded some HR groups and things like that from larger populations, like, hey, I have nobody in Western Kentucky. Here's this, do this, right? Or I have no one in Eastern Kentucky, can you do this? You're a big employer, they're gonna trust you. It's really important to do that. And knowing where those connections are takes some time, you know, but that's important.
Great. And shifting gears a little bit, how can individuals use the toolkit to make a difference? So if someone's not working in mental health, not working for an organization, how can they use it in their own community?
I think the toolkit, the beauty of it is it is really designed for anyone and everyone to utilize. So I think some really easy things people can do is to pop the social media language onto their own feed. You know, having more conversations openly and honestly about mental health is going to help us address the stigma. So if you are an individual who wants to spread awareness, you know, that might be the best way, you know, to get the word out is sharing some information on social media. Having conversations with your friends and family using the key messaging in the toolkit is another great way. And the worksheets are designed for you as an individual to be able to do yourself. So, you know, if you're really struggling with stress and trauma after the year that was 2020 and 2021 continues to be, you can go through the fact sheet on stress and trauma and then fill out the worksheet and kind of work on some of those things. So I think those are some ways that an individual can really get involved.
I think too, we sometimes forget that as individuals, we have power. I know that's easy for us to say, but even if I wasn't working at MHA and I'm working somewhere else, anywhere else, I can say to whoever, if there's an opening for it, right, a space for me to have this conversation, hey, you know, it's mental health month. Can we do something about it? Here's content that you can actually share with the rest of our team. Again, because they may not be familiar that the resource exists. It doesn't put any onus on you to actually go out and do anything other than here's a link to all this information. This national organization created this, right? So part of that, I think, exists in the power that lies within each one of us. But also thinking about the connections that we may have. So for folks that are part of community organizations, sports, you know, faith-based organizations, if none of these support systems that you are part of have ever really spoken about mental health, that is another way that you can say, hey, it's Mental Health Month. Did you guys know that? You didn't know that? Well, hey, look, there's actually all these tools. And then if they want to, they will do something with that information. But ultimately, what ends up happening when we go out into the community and we have these conversations, we generally get two types of responses. One, people say, oh, well, I don't have anything to do with mental health. I'm fine. And they're like, I'm not crazy, right? That's generally the kind of language that we see and we hear. And it's like, it's not about being crazy. It's about taking care of your emotional well-being. And then it's like, oh, well, yeah, I guess I am interested in that, right? So we kind of latch into a conversation in that space. The other side of it is for people that are more hesitant, all of these pieces are intended to then function as a first step in guiding people down a path of understanding more. So you can say, it's okay if you're not ready to have this conversation, you're not interested in it. Just in case, here's the information. It exists right there, right? So there are a lot of opportunities that exist just in you doing more personally to share content, if you're in a space that you are safe and are able to do so.
All that. I don't think I have much I can add to that other than, you know, sharing a social media post to a group of friends that hasn't usually seen that kind of information from you can actually be one of the most powerful things I've seen lately. People are sharing our posts and getting a lot of reaction of like, oh my gosh, yes, that, especially that stress and trauma piece and things like that. They're like, everybody is okay right now and feels safe talking about it. So this is the time. If you ever wanted to speak up, I really think this is it.
Great. And we have touched on this quite a bit, but getting a lot of questions about it. How do you reach people who aren't necessarily interested in mental health or are resistant to talking about it? So if you're at a health fair or something and you start to talk to someone and walls just kind of go up, is there any way to kind of pull them back in and get that conversation started?
Marcy, you go ahead.
I'm gonna say, I used to be at a different kind of mental health table and people would run away from us because mental health was in the name. So that has not happened to me at the last several health fairs I was at before COVID, really the last couple of years. People seem to be more interested in the screening. So I emphasized the screening piece. And we ended up being sat by the organizers of some health fairs right next to blood pressure. Right. And the fact that we're right next to another screening really helped with that line. So position is everything in a health fair. And if you're close to something that everyone wants their blood pressure and their sugar checked, right? Like I'm from Kentucky, it's sugar, not diabetes, right? Here, so you check on your sugar. So if you can have the mental health in that line that's waiting to get all of those, that's really helpful at capturing people who would normally not be a captive audience. I also think being in those unexpected places, those unexpected health fairs at the state fair, right? Who expects to see mental health group there? That was really helpful for us. Who expects us on a union shop floor? I've been there before. They've invited me for May, bring a table, bring the flyers, give it out on the shop floor during break. So those kinds of things are good, and making those connections and not limiting yourself to thinking about where you might be able to go. Letting some students and college students come in and have ideas has been really good for us as well.
I think too, one of the most interesting things is, in my experience, and I've been doing this work for a very long time, the people that in some way are hesitant to approach your table, even lock eyes with you in many instances, are the ones that need most support. So what we end up doing in many ways is we have a range of different materials that may be available for people to pick up. What we have done is actually utilize our screening information, and we make it available in different sizes. from a small business size card kind of piece of content to like a postcard size to a whole fact sheet, right? And that allows for anonymity, right? And it doesn't require for you to have a conversation with me. You can just go look and you swipe, and pick it up and walk away, and you would never know that you've even approached the table. So part of that is done with purpose, right? You do not have to feel like you have to engage with us. We're creating an open space, really an open enough space that you can come in and grab what you need and walk away. The other piece of that is really helping to counter some of the negativity that may be experienced when individuals are thinking about addressing their mental health. Like I said, when we've had a range of different situations come up where people are like, why are you guys even here? It's not even important that you're here. And it's like, actually, have you ever had a rough day? And, you just change the conversation to help them understand that it's not an attack on them, and it's not an attack on any one person. It's just increasing awareness around a really closely tied aspect of our lives, in the same way that we talk about physical health. And that's where language is very important to help normalize it, right? And then for folks that are really in a complete opposition of you being there and having any conversations, then you say, it's okay, it's not a problem. If you're interested, here's our information, and you leave it up to them. And part of that is managing yourself, right? Your emotional response to this, because it's not a personal attack on you. And also making sure that if you have volunteers and other staff that are there, helping them understand that and how to actually move through this process of communicating with people around all of these issues.
Ditto to everything. I think we have gotten a lot of, when we were in person doing health fairs or events like Marcy and America have touched on, it was we'd stand out there and be like, do you want to take a mental health screening, or do you want to learn more about mental health? And we would get the response of, I'm not crazy. I don't have any problems. Oh, I know someone though that does. I know the crazy person in my life that needs to come. Like, those were a lot of the responses that we would get. And I think America makes such a good point that, it is not your job to change opinions, but you are given a unique opportunity to maybe destigmatize that a little bit for them. And the line that we will often use is, well, we've all had the bad days. So I'm probably that person sometimes too that needs the mental health resources, because here I am, standing there all professional and being able to humanize that and share. And oftentimes we will share our own stories if it feels appropriate with the individual. I was talking to a woman who, I think this was the first time she had ever, talked about mental health and had even thought about it. And for me to be able to say, like, me too, it took me a while to realize that my panic attacks were what they were, or to decide that I wanted to go on medication, and talk about the personal part of that and how it's a journey, and all of those things can really help open up conversations for people. So I think you just kind of have to go in with your own open mind, and know that stigma is still prevalent. Sometimes I forget, because I'm surrounded by such amazing advocates like on this call today, that it's like even a problem until I go out into the world. So I think the more that you're advocating, the more you might run into some of that. And just to remind yourself, like America said, it's not your job to change everyone's opinion, but the more that you just show up in our presence, you're going to change some minds as well. But humor is always a great thing to fall back on. You can always call yourself, well, if we're going to start telling people, they're crazy, you better start with me, things like that can always help break down some of those walls, and laughing is always a great.
Yeah, one of my taglines for offering the screening is, do you have a brain? And there's always someone who's, I don't know today, or we don't know, does he have one? I don't know, it starts that conversation. I'm like, well, you have a mental health screening, because everybody has a brain, right? Whether it's working well or not, and kind of go from there. So that's kind of my seg, but I love that you have the same kind of, it's a rapport you build up, even if it's not necessarily starting from a great spot.
Absolutely. That's such a good one. Yeah. We always say, like, well, every single person has emotions, whether you like it or not, so things like that can be really, really helpful.
Awesome. So much great advice today. So many great tips. We'll wrap there as we're about to hit 4 o'clock. Thank you, Whitney and America and Marcy, for sharing these resources and how to use them in local communities. We'll be in touch with everyone in the next few days to get you all the recording and the slides and that link to request your certificate of attendance. And if you haven't downloaded the toolkit yet, it's at mhanational.org/May. Thanks everyone, and enjoy the rest of your day.